Okay, let's jump right into something you've sent us material on, something incredibly, almost universally relatable. Lower back pain.
Oh, yeah. It's huge.
Seriously, the research you've provided, it highlights just how common this is affecting, what, close to 80% of people at some point?
That's the number, yeah. Nearly everyone bumps up against it.
It's this persistent, sometimes nagging, sometimes really debilitating issue that so many of us just sort of live with.
We do. And
Mhm.
because it's so common, people sometimes, dismiss it. But the material shows understanding it is really key
Why is that?
because it can have pretty significant impacts on your daily life if you don't.
Absolutely. So our mission with this deep dive, looking at the material you've shared, is to get a handle on what exactly lower back pain is.
Right.
One of the most frequent culprits behind it, the potential risks if you let it go unchecked.
And what actually helps.
Yes. What the experts recommend for managing and treating it, and maybe most importantly, proactive steps you can take to prevent it becoming a major problem.
Sounds like a plan.
So let's start by defining our terms. What are we actually talking about when we say lower back pain?
Okay, so when we talk about lower back pain, we're focusing on the lumbar region.
Lumbar region.
Yeah, think of that area like below your rib cage, but above your hips. That's what the lumbar spine is.
Gotcha. Right, the sort of workhorse section of your spine.
Exactly.
And your material makes it clear this isn't just one single experience, is it?
Not at all. It can be anything from a dull ache, just a mild annoyance, all the way to truly severe disabling pain that really stops you in your tracks.
Wow, okay.
Yeah, the spectrum is huge. And often that difference, that variance in experience, it's tied directly to what's actually causing it.
Okay, so let's unpack some of those common causes outlined in the material. You've got the usual suspects we probably all think of first.
Like poor posture, for sure. I mean, especially with so many of us spending long hours sitting.
Right.
That sort of slouching position really puts undue strain on the lower back over time.
Makes sense. And lifting wrong.
Oh, classic.
Yeah.
Trying to hoist heavy things by bending your back instead of using your legs. It's a textbook way to cause immediate strain.
Or just overdoing it generally, right? Like a muscle strain or a ligament sprain from pushing too hard during exercise, or even just, I don't know, an awkward twist.
Precisely. Happens all the time. Then you get into issues with the actual structures of the spine itself.
Okay.
Things like disc problems. The material mentions herniated or slipped discs.
Can you give us a quick picture of what's happening there? What's a slipped disc?
Sure. So think of the discs as little cushions, kind of like jelly donuts, between your vertebrae, the bones in your spine.
Sure.
A herniated or slipped disc is when that cushion material, the jelly, bulges or even ruptures outwards.
Ouch.
Yeah, and that bulge can press on nearby nerves.
Ah, okay. And pressing on nerves sounds like it could lead to more widespread pain. Which brings us to another point from the material, sciatica.
Yes, exactly. Sciatic is a specific type of nerve pain. It often originates from pressure on the sciatic nerve.
Which runs where?
It starts in the lower back and runs down the back of your leg. So that pressure, maybe from a herniated disc or other spinal issues, can cause pain, numbness, or weakness that radiates down the leg, not just in the back.
Got it. Now, here's where the material takes a slightly more, maybe surprising turn for some people. The connection between emotional stress or anxiety and back pain.
It's fascinating, isn't it? But it makes sense. Stress doesn't just affect your mind. It causes real physical tension.
How so?
Well, when you're stressed, your muscles, including those in your back, can just tighten up chronically.
Right.
And that chronic tension can absolutely contribute to or, worsen lower back pain. It's a feedback loop sometimes.
So it's not all about the physical mechanics, the lifting and sitting. Interesting. The material also helpfully distinguishes between acute and chronic pain.
Yeah, that's a really important distinction. Acute is the kind that comes on suddenly, maybe after you lift something wrong, and lasts a relatively short time. Usually less than 6 weeks, typically. Whereas chronic pain, well, that just persists. It hangs around for much longer.
And that duration is key for doctors.
Absolutely. It's a key diagnostic factor when healthcare professionals are trying to figure out what's going on and the best way to approach it.
So if lower back pain is this common and it has all these different causes, is it something we should just, I don't know, grin and bear? Or does the material highlight serious consequences if you ignore it?
Oh, it definitely underscores the potential harms of leaving it untreated. Don't just ignore it.
Like what?
Well, what really stands out is how significantly it can just disrupt your daily life. Simple tasks you don't even think about normally.
Like tying your shoes?
Exactly.
Yeah.
Bending to tie your shoes, standing at the kitchen counter, walking the dog. They can become agonizingly difficult.
And I imagine that bleeds into other areas, like sleep.
Totally. How can you get restful sleep when you're constantly trying to find a position that doesn't hurt?
Yeah.
It's exhausting. And that lack of quality sleep, combined with just the relentless nature of pain, it takes a real toll on your mental state.
How so?
The material points out a strong link between chronic pain and increased rates of depression, anxiety, and just general frustration or like a feeling of being helpless.
That makes sense. And the most concerning point raised in the material is probably the risk of permanent damage if underlying issues aren't addressed.
Yes, that's the serious end of the spectrum. If you have nerve compression where a nerve is continuously being squeezed and it isn't relieved, it can potentially lead to long-term, even permanent nerve damage.
Wow.
And if spinal degeneration, which is basically the wear and tear of the spinal structures over time, is ignored, it can worsen and cause irreversible problems down the line.
Okay, that definitely raises the stakes. So what can we do about it according to the material? It seems to lay out several different approaches.
Yeah, thankfully there are things. Let's start with some home-based strategies, which can be really effective for milder cases or just flare-ups.
Like heat.
Exactly. Using a hot compress, like a heating pad or even a warm towel for about 15-20 minutes, that can help soothe tense muscles and increase blood flow to the area.
Okay. And what about movement? Should you just rest?
Not necessarily. Gentle movement is often highlighted. Simple stretches and specific yoga poses can actually make a big difference.
Which ones does the material mention?
It names things like cat-cow, child's pose, and cobra pose as good options for releasing tension in the back gently.
Right, familiar ones. And posture again.
Posture comes up again, yeah. Maintaining correct posture is stressed sitting upright, being mindful of your body alignment throughout the day, not just when you're thinking about it at your desk.
Easier said than done sometimes.
Tell me about it. And even something as simple as your mattress choice is mentioned.
Right.
Yep. A firm or orthopedic mattress can provide better support for your spine while you sleep, which is, a third of your life.
Good point. Okay, moving beyond those immediate remedies, the material also touches on diet and nutrition, specifically calcium and vitamin D.
Yeah, these are crucial for maintaining strong, healthy bones, and that include your vertebrae. Strong bones provide better support.
And where do we get those?
The sources listed include things like milk, yogurt, eggs, fish, leafy greens, and crucially, getting some daily exposure to sunlight for vitamin D production, or supplementing if needed.
Okay, so what if home remedies and diet aren't enough? For more persistent or severe pain, medical interventions come into play.
Right. Over-the-counter pain relievers like ibuprofen or paracetamol can offer temporary relief for, getting through a bad patch.
But not a long-term solution usually.
Generally not, no. And that's where physical therapy often becomes a cornerstone of treatment.
What does that involve?
A physical therapist can design a personalized program of exercises. It's about strengthening the specific muscles that support your spine and improving your flexibility and range of motion safely.
Tailored to the individual.
Exactly. And the material also mentions some alternative therapies.
It does, yeah. Things like dry needling, acupuncture, or cupping. But it comes with a really important caveat.
Which is?
Absolutely crucial that these should only be sought from licensed, qualified professionals. You need someone who knows what they're doing.
Definitely. Ensure safety and effectiveness. Don't just go anywhere.
So given all these options, from heat packs to PT to acupuncture, when does the material suggest it's time to stop trying things at home and actually see a doctor, maybe even a spine specialist?
There are some key red flags mentioned. If your pain persists for more than 6 weeks, despite trying some of these things, it's time to get it properly evaluated.
6 weeks is the marker?
Generally, yes. But there are more urgent signs too. Things like experiencing numbness or weakness spreading into your legs. Or, this is serious, issues with bladder or bowel control. These can indicate significant nerve compression that needs prompt, maybe even urgent medical attention.
Okay, those are definite. Go see the doctor signs. And if you do go, they might recommend imaging tests.
Yes, that's common.
Yeah.
Tests like x-rays or MRIs help them visualize the bones, the discs, the nerves in your spine to try and pinpoint the exact source of the problem.
Right, get a clearer picture.
Exactly.
So circling back then, knowing all this, the causes, the potential downsides, the treatments, what does the material suggest we do to try and avoid this pain in the first place? What are the prevention strategies?
Proactive steps are really emphasized throughout the material. Avoiding prolonged sitting is a big one.
How often should you move?
The suggestion is setting a timer, maybe getting up and moving around, stretching a bit every 30 minutes if you can.
Okay. And the workspace.
Making sure your workspace supports good posture, an ergonomic chair if possible, proper desk height so you're not hunching.
That makes sense. And lifting again.
Revisiting that correct lifting technique is key. Bend your knees, keep your back straight, engage your core, and let your powerful leg muscles do the actual work when picking up heavy objects. Don't lift with your back.
We hear it all the time, but it's crucial.
It really is. Maintaining a healthy body weight is another important factor mentioned.
Why is that?
Because excess weight puts extra constant stress on your spine, particularly the lower back. And finally, just incorporating daily stretches and some form of light, regular exercise. It keeps your back muscles flexible and strong, making them less prone to strain in the first place.
So it seems like a lot revolves around movement, posture, and being mindful of how we use our bodies.
Pretty much, awareness is key.
Okay. So we've taken a pretty thorough deep dive into the material you shared on lower back pain. We've covered everything from its common origins, the very real risks of ignoring it,
The whole range of ways it can be treated, from simple home care to medical interventions.
and importantly, those practical steps you can take to try and keep it at bay.
Yeah, and it's clear from this material that while it's incredibly widespread, lower back pain isn't necessarily something you're powerless against
Yeah.
or just have to grit your teeth and endure.
No, there are options. There's understanding to be had.
Exactly. There are many points of intervention, many things you can do.
Right. And thinking about the sheer number of factors that can contribute, I mean, from something as external as how you lift a box to something as internal as your stress levels, and the fact that it can truly impact almost everything you do every single day.
Mm.
Makes you wonder, doesn't it? What small, consistent step, informed by the stuff we've explored today from the material,
Yeah.
could make the biggest positive difference for you? Maybe it's related to your posture, maybe just moving a bit more, or perhaps even looking at how you manage stress.
That's a really good question. Definitely something to ponder as you digest all the information we've unpacked today from these sources.